Good morning. Thank you for having me at this wonderful event. It's really more of an honor for me to speak to you than you to listen to me, because, being in this profession for a long time in my life, I know it's only going to continue in a great way with people like you sitting in this room. And you are truly the future of this profession. And it's a profession that is going through lots of changes, and it's sort of nice to ride the wave and be part of that, because I think it's all going to be excellent. And by the time you're done with your training, hopefully a lot of all of the changes will be employed, and you can move forward with your careers. A little about me: I am an osteopathic physician. I came from a family of osteopathic physicians, many who went to the Philadelphia College of Osteopathic Medicine. I went off to Kansas City to do my training, and then I trained at in the hospitals in Michigan. I did my internship in general surgery, and then went out to Philadelphia to do my urology residency and stayed there. While at PCOM, I have been chair of specialty surgery out there. I chair the division of urology. We teach a course in urology there as well. And I have been involved in residency programs, first with PCOM and then with Einstein Urology, and currently with Einstein. And now we started a new residency at Hahnemann University Hospital, which is affiliated with Drexel Med, but has remained pretty much an osteopathic residency, although we do have ACGME approval, and we had our initial accreditation a year ago, which is very exciting as well. So as we move forward, and there are lots of changes, and all the changes I think are really good, because it holds us to a standard that we know that we should be at. So it's not just preceptorships, it is residencies that expect and demand certain guidelines and things that are necessary to make to create great residents. And so it's good for all of us. And I think that over time, our programs that will provide excellent residents, and that will go out into. Anyway, so why are they doing this? Why are they doing this to many of us that thought we were doing so well? Well, it's really a lot easier to have one graduate medical education program nationally. And there's only, the deal is that there's only so many dollars, and with so many schools that are exploding with lots of students, it's a lot easier to teach and to have, again, standards that are pretty much equal across the board. The merger should be completed by 2020, and through your time here, I am sure that you will have some people that will come and speak with you that are more intimately involved in the mechanics of the merger itself. But most likely, it shouldn't affect you as much. It affects the programs that are currently undergoing this change. And so, again, it's what we have is that everybody's in their programs, and they are trying to get accreditation through the ACGME. And this has been going on for several years. And there was a pre-accreditation, and then there is an initial accreditation by the ACGME, which allows the residents, once the residents are in an ACGME program, they can then, it's sort of an equal playing field. They can apply and take the boards in the allopathic world. It gives everybody, you can be an osteopathic physician, and and medicine, again, there should be no barriers. You should be able to, if you're qualified, to be able to do fellowships. And likewise, if there are allopathic people interested in the holistic approach or primary care, that they should be able to come out and visit or be part of our residency programs too. So it's going to be a process that's going to be changing over the next several years. I think that, again, it will all work out in the long run. Most importantly, you want to get the best education, and you want to be able to go out and be able to provide excellent care someday. But most important, as an osteopathic physician, you're always going to be an osteopathic physician. So if you go out and you believe that you're going to go do an allopathic residency and a fellowship, and you don't need your osteopathic history or the life that you had in school, you're clearly mistaken, because those letters after your name, DO, will follow you forever. So you should be very proud of being who you are, and proud that you can accomplish whatever you want, hopefully someday, with those letters after your name. And many of us have. Many of us have lived in a mixed allopathic osteopathic world. And as I said, I'm in a primarily allopathic institution with lots of osteopathic physicians in our hospital who hold leadership positions and are highly respected. So again, being an osteopathic physician is something that you should be very proud of. So again, it's an even playing field. That's what we hope to accomplish, that you're going to be able to go out and, again, practice medicine and not be hindered by, because, a perception of less excellent education. So the secret of getting ahead is getting started. So I also want, being someone that has been involved as a resident trainer, I have not only residents, but I have lots of medical students that come and rotate with us. So, being a program director doesn't mean that I'm uninvolved with students. I have lots of students that are, rotating in the hospital, that spend time in my office. I have a research center too, and we have students that do research with us as well. So I am very well plugged in to what goes on in your world. Some of you who are in, thinking about doing auditions or deciding what you're going to do with your lives, in today's world is a lot different than my world when I trained. We applied for a rotating internship, and then we had the time to make decisions on what rotations or what areas we liked. We didn't have to accelerate it by the second year of medical school. We had the ability to at least get through our fourth year and then decide, if you were open-minded, what was the best choice for you. And good and bad, you have to make decisions a lot sooner. And I would think that, you have to strategize earlier, and usually by your third year, you have to know whether, you like medicine, you like surgery, are you interested in a subspecialty, do you want to stay in primary care? There's so many things that you have to decide a lot sooner than many of us that had to do years ago. Good and bad. And hopefully it's good because there's so much more information, and you've accelerated in your learning process so much more. So it's really important to do your homework. You need to research programs that you are most interested in. You really need to mine the data, and you need to be seen. You need an audition rotation. I'm not telling you something that you don't know, but as a program director right now, I have 2 spots a year, and we have close to 200 applicants for those 2 spots as of last week. And that's a lot of people that are applying to a program. But for me, it makes it sort of easier, because I would say about 140, 150 of those people never walk through my door. So if they're not interested enough to come and visit with me, unless they're really spectacular and really decided, last moment, I'm not really interested in them. So I want to know that you have come and at least spent a little time with us. Whether it's an elective and you come for a month, which is phenomenal, or if it's even that, you're in a school that doesn't allow you out very much, and I appreciate that. I know that everybody comes from different schools with, some are very liberal in giving you elective time and some are very not, and I appreciate that. So, but at least if you make the attempt, you're interested in programs, you need to come and visit. So there is no perfect candidate. No one is perfect. So when I look at someone's credentials, I'm not going to expect that they are perfect. There are some CVs that I have, some that I never saw these kids. They just send their applications, and they may have long laundry lists of research that they've been involved in, or they've been tagged on lots of papers. That doesn't necessarily mean they're perfect candidates for our program. So you can have perfect scores, the greatest grades, but if you don't click, if you don't have the ability to mesh with the programs that you're interested in, you're not going to be high on the list. So it's important that you need to you need to have self-confidence if you are looking at a program and feel good about it. But again, nothing great was ever achieved without enthusiasm. So it's important that if you're interested, that you're going to do all that you can do to make sure that that month or 2 weeks elective in an area that you believe is an area that you want to pursue, really important. So you're going to do, again, things that, that are going to hopefully put you in a good light. So, scholastics obviously are important. Board scores are important. Scholastics, you need to show that you've done fairly well. You can't be in, and again, it's different. There are different areas. So if you're going to be looking, a lot of you are here because you're interested in surgery. So and if you're interested in surgical subspecialties, it just becomes more difficult. There are more schools that are exploding more students, especially in our profession. And it's not as though that the residency programs have opened up and made lots more spots. They have not. I'm the first osteopathic physician on the urology review committee for the ACGME. And we review all the programs nationally. And there are lots of programs that come forth with wanting to expand their programs. And it's very seldom that they get the okay to even add one additional resident in a program, because they don't believe that just the numbers are important. They want to know that the educational experience is going to benefit that program. So they aren't really open to just swinging the doors open in residency programs. So it becomes more difficult. So again, you're going to be looking at programs that are going to, that are going to be looking at you in a good light. So you have to do your homework. So you need to have fairly decent grades. Board scores, I'm not going to give you numbers, but they're certainly looking at the osteopathic, complex or USMLE scores as well. You can look at what these kids get, or at least the minimum to get you in the game. So obviously, those areas are pretty important, but they're not the most and only important areas. So it's the whole package. So scholastics and board scores are important, but there are other things that are important too. And being an osteopathic student or a physician makes you even a little more special, because you have sometimes the ability to, it's not been shown, but many have personalities, they have the empathy, they are a little more hands-on, touch patients, so I think that being a DO and having all of these things really puts you in a great position. If you're able to do some research in the areas that you're interested in. Now, no one's expecting you to do, and everybody is in different situations. So there are certain areas that are in more of a, an urban area. You might have more access to more schools, to more residents. And even if you're in less, in more of a rural areas, there are still ways of doing some research projects. Does it have to be in the field that you're interested in? Not necessarily. It's just showing that you have the ability and the capability of writing papers, of presenting data, of getting up and speaking. In the ACGME, which again, we're bringing our residents up and our programs up to a level of excellence, and not that many weren't doing it before, there is scholarly activity that is so important that we are graded on. So it's the program chair and core faculty, the doctors that are affiliated with the residency program. We are expected to have a certain level of scholarly activity. That includes publications, that includes being able to present and present data and poster sessions, but mostly the residents should have that ability, and you would want to do that because it also improves your resume for when you go out and get a job and look for a job as well. So these are nice things to have the comfort of being able to stand at a podium, whether there's 3 people in the audience or if you are at in the urology world, we have the AOA, and our residents have presented at what's called late-breaking sessions to a large group of people and defending some of the information that you're presenting. It's exciting, it's fun, research can be very fun as well. So if you have that ability to do some, whether it's at your schools or with some docs that are in your area, or if you go on rotation and you connect with some of the residents or attendings, they will be more than happy to have you help them. And it tags your name, also getting some publications. All good stuff, and it's greatly appreciated and remembered when you go, whether it's during your audition, rotation, or if you go for an interview. Those things are noted and remembered. So, just a bunch of pearls just throwing out there. Letters of recommendation, obviously, if you spend time on a rotation or with some physicians that are truly, that get to know you a little bit, it's always nice to ask. There's nothing wrong with that. Many of us will be happy to accommodate, unless, you really did a suboptimal job on the rotation, then hopefully you won't ask, but because a bad letter is probably worse than no letter. So, but you would have that sense. For many of you, you're not sitting in this room because, it's an accident. You're all, the cream of the crop, and I would expect that, as you go on rotations or if, and as you're on rotations, you will understand that. And through this weekend, you're going to get lot more pearls from a lot of people, seeing it from different aspects, different. We all see. You line up 10 surgeons, and we all have different opinions. So it's good to take in a little of what all of us have to say. So obviously, with scholastics and board scores, obviously the higher the scores, certainly better chances. I can't tell you, sometimes there are certain programs that will use a cutoff. It's sort of cold sometimes. We don't do that in my program, but when you get a huge amount of applicants, they have to use some standards. It's almost like college as well. Some colleges won't, look at your applications if you, scored poorly. So it's same thing. If you only have a few spots and, you're not going to, if you've got a large amount of candidates that have, fairly decent grades in board scores, these are the people that you're going to be looking at. But again, it's not only those areas that we look at. And, there are people in gray areas, some which are, are spectacular residents. So again, I don't always look at just scores. So, we discussed the COMLEX and USMLE as well. I'm not going to give you numbers, but you can surmise that obviously you need to do half decent to be considered. So research and publication enhances an application. It's always good to try to find a mentor in the specialty you have an interest in. It's just obviously you're going to want to make a lifetime decision. This is the area that I want to work in, so you need to explore what is their life like. Is it something that that it may appear sexy up front, but you spend a little time and you say, this is not for me. And that is really important as well. You don't want to wake up in your third or fourth year of your residency and say, I can't do this anymore. It's got to be that, you have to wake up every day and say, and every day isn't so wonderful, but, I can say that I'm really happy doing what I do every day. Are there days that stink? Absolutely. Are there days that I want to run away? For sure. But for the most part, I think that I made the right choice, and given the opportunity, if you meet doctors that are unhappy with their lives, run away, or look at other, that doesn't necessarily mean the area of medicine that you're interested in isn't great, but you don't want to surround yourself with negative people. It's got to be positive. You want to, you're talking about the rest of your life and wanting to do something that's phenomenal, and you don't want negative vibes. So I would, tell you, find different people. It doesn't have to be one. It might be a resident that you might have met and might have kept in contact with. It might be an attending or someone in the community that sort of inspired you to do what you're doing, that wanting to do what you do. But it's always nice to have a mentor. Residents, when you are doing rotations, welcome the assistance in data mining. Many are doing, they work hard, as you know, and they also are expected to publish some, or at least present papers, and they always appreciate assistance. So if there's something interesting in the hospital, or a review to be made, getting data mining through the through the different to get a PubMed article, to data mine is really very helpful. And then helping to write different papers, if you're good at that, or helping the residents is phenomenal. So and it's just good for you as well. Is it necessary that is that going to get you a spot? Well, it's certainly not going to hurt. And understand that when we look at residents or potential residents, we don't, this isn't just my choice. When a student is around me, I promise you they're going to be on their best behavior in a way. I hope that they're going to be comfortable and they're going to enjoy themselves and relax enough to get to know them, but certainly they're always going to be on good behavior. When you're with the residents or in the hospital for 8-10 hours a day, the residents get to know you. And I'm in a program where I really value the people that we've selected, the residents. I value their opinion. So when I sit at when we interview, the interview isn't just with me or just with the faculty. The residents are involved as well. And some people don't always understand that it's not just my decision, it is the decision of the program. The people that are truly involved in everyday life in a residency program. And especially the residents that are currently there. They want to know if we're gonna select somebody that is going to work with, easy to work with in the future, because they're the ones that will have the impact. Not so much me, but the people that you work with within the hospital. So important that you make nice to the residents. But on the flip side, if you're you're at a hospital and you really don't like those residents, that's not really where you want to be either. So 4 or 5 or 6 years of hell is not exactly what you want to sign up for. So you have to evaluate that, and you have to find out is it hell because of what they're doing? Are they treated poorly? There are a lot of different, or they just a bunch of jerks that just, make nice to the attendings and then turn on the students. I don't see that in our program or the programs that I've been affiliated with. The residents are usually extremely helpful and looking forward to their future. So they're going to do all that they can to better their lives and also, better your lives as well. So I know that in my experience, students that spend time with the residents get a better sense, get a true sense of that program, and and again, every program is different. So you may love the field, but you may not like the way that is run over another. So with audition rotations, you want to strategize. You need to strategize. You need to figure out your schedules. If you know what you're doing, if you think you know what you want to do, you got to figure it out. I'm not impressed as a resident program director if you spend, you come and you have not rotated with anyone, you haven't rotated with me, but or if you spend 2 days with me, but you've been to Harvard and Yale and to Duke and all these very fancy institutions, that doesn't matter. Okay, being in a program where you observed, but you could say you were there means nothing. I want to know, you can go to, there are 10 urology programs, and if you've spent, you've rotated around to several of them, great. I know that, you're going to have a better chance in the programs that have been osteopathic friendly than the ones that have never taken an osteopathic physician. Not to say that they won't in the future, but, don't waste your time. I mean, obviously, if you really you're looking at some subspecialty or some academic, in the future, position in the future, I understand it. But don't load up your schedule with electives that don't help you getting what you want. You need to be seen by those programs that are going to, give you the opportunity to get a residency. So that really is important, and I think that, I never understood why, kids would go, think that that's going to impress us, and it doesn't. I want to see you. I want to know that or be seen by some of my peers in some of the other programs. Because many of us are very, very friendly, and we want to listen, I wish we had spots for all the people that wanted to be a urologist, but we don't, and hopefully those that are not going to get into our program have, a great chance in some of the other programs too. So, we keep, we certainly want the best and, the brightest, but we also want people that are dedicated to furthering our profession as well, as long as we can do that. So be realistic in picking rotations, be attentive, responsible, helpful, and available while you're on rotation. You're going to have some talks about the do's and don'ts of, when you're on an audition. You want to be prepared. If you see something, no one expects you to know everything. If I have a student that comes in July as a third year, or even in the beginning of a fourth year, my expectations are not, I don't expect them to know everything. I do expect them to go and read a little afterwards. Or if there are surgical procedures the next day, read a little about it. Doesn't necessarily mean that you're going to be at the table doing the procedure, but you should have some sense, some ability to know what is going on. And usually the residents will be very informative. Many times they will ask you to give a little talk, and it's a great way for you to learn and get the experience. If you are given the opportunity to go do consults in the hospital and examine patients and fully examine a patient. In urology, we're urologists, so I'm not listening to the heart so much, but you can't not do a rectal exam. You can't not do a pelvic exam if it's a female. You need to touch the patient. You need to examine the patient. And that's where you learn your experience. If you don't know what a normal prostate feels like, you'll never know what an abnormal prostate feels like either. So, that's just one example. If you want to listen to the heart and lungs, that's, perfect. But again, it's really important that you touch the patient, be accessible to do consults and present them at the appropriate time. You want to do presentations if given the opportunity, which is, again, the ability to allow us, to hear medical students. I want to know that you're able to do all the things, and many, most of the students are excited to be part of a team. And we, in my residency program, the students do become part of the team. You're going to be in the OR or in the clinics and do all the things that the residents do under their supervision as well as the attendings. But it's fun. It should be fun. You should be learning. It shouldn't be although it's important to the rest of your life, it should be something that is natural and something, again, that you're not nervous about every single day. You shouldn't be. Because, again, you're there because you earn the right to be there. So, no one's questioning your intelligence, whether it's, the top candidate or the last candidate. You're all excellent. So enjoy your rotations, but also, look for those opportunities where you can enhance yourself. Whether it be research opportunities, giving different presentations, but you need to also, check it out. Some programs are going to be a lot more liberal regarding that versus others that will expect you to just basically observe. So you're going to find that different flavors everywhere. It's all not going to. So, you don't want to be overbearing. You don't want to come in very forceful. You don't want to be a know-it-all. You don't want to force yourself and, to be a show-off. You can have 5 other students and you push yourself up and say, you know what, do you mind if I present everything? And the residents look at you as if you got 3 horns, and you don't want to do any of that. And it's been done, and I get it. I understand that you want to, break out of the crowd, but you realize, you can be very quiet. I have residents that, were probably the least vocal, but they were thoughtful, they were intelligent, they were appropriate, they were interested, they did all the things that they had to do, but they certainly didn't push themselves, to be obnoxious. So you want to be respectful, obviously, to the residents, the program coordinators, the nursing, ancillary staff. You have no idea how involved, at some hospitals nursing is. It's almost like, they've got a good eye as well. They know, people that have been around for a while, they're as much invested because they have to work with these residents as well. And they want to work with people that they, find easy to work with. So really important. And be careful of your texting while you're on rotation, or sexting, which has happened, and you have to be careful because it's, who you're doing it to, and, you don't want something to go viral, especially on your audition, especially if you're really, don't let down your guard so much that, you're so comfortable. The programs you rank high should be ones you felt would be a great fit. Relax. It all works out. Sometimes you may not get exactly what you want, and you may be somewhere else, but, I really believe that, there's, things happen for a reason, in life. And, it was meant to be. Whether you got your first choice, the first choice, in comparison to what you might have gotten, it definitely all works out. You got to be positive and very self-confident, but you always have to have a plan B. Don't just don't, say, I'm going to be what I want to be, and I will try year after year after year for the next 5 years. Be realistic. You're talking about a life. Some will be married, some will have kids. You do have responsibilities, and sometimes, again, plan B may be a lot better than plan A. So don't be unrealistic. You know, you know, think about all of you, what you thus far, and you're all gonna do well. So Colin Powell said, success is the result of perfection, hard work, learning from failure, loyalty, and persistence. So